I want to talk about reactive attachment disorder more specifically. So, reactive attachment disorder is a diagnosis that's in the diagnostic. Tell me what it's called, the DSM. What does it stand for?
DSM-5, the Diagnostic and Statistical Manual.
And so that is the manual that psychiatrists and psychologists use that sets out the standard diagnostic criteria for a lot of psychological and psychiatric conditions.
That's true.
Also has some behavior disorders, some personality disorders, lots of different things. But it's a standardized way in which we evaluate if someone meets those criteria, correct?
That's right.
And you couldn't formally make the diagnosis in this case of reactive attachment disorder.
I did not, no.
But your opinion that there is some reactive or there's some attachment disorder characteristics here is based on the review of records of other people, correct?
Yes.
You don't know the methodology that any of the other people who looked at him relied upon, correct?
Yes, I don't know specifically. I know if they're licensed, then they would have to abide by, whatever their professional license is and the DSM to make a diagnosis.
But the reports that we have don't go into the underpinnings of their diagnosis, correct?
No, you wouldn't necessarily get that from anyone exactly how they got to their diagnosis, but you would assume if they're licensed that they have taken tests and been educated and supervised and know how to diagnose appropriately.
One of those people that made a diagnosis is a Mr. Kenny Miller, correct?
That's correct.
He is actually a licensed clinical social worker, correct?
Yes, he is.
So that's a master's level practitioner, right?
Yes, he is.
Not someone who has a doctorate like yourself or Dr. Myers.
Correct, but I will say that some of the best clinicians I've ever met in my life are licensed clinical social workers. So just because they have a master's degree as opposed to a doctorate doesn't necessarily make them a lesser clinician.
You actually, though, don't have any of Mr. Miller's clinical notes, correct?
I do not. Only what I was given, which I believe was a letter talking about when he had talked to the Ferriters and when he had seen them.
Okay, so you don't have any of the treatment progress notes that were contemporaneous to when he was treating in this case, correct?
Yes, I do not.
The only thing you have is a letter that he wrote after the defendants were arrested, correct?
Yes.
And the letter doesn't explain the diagnostic criteria, correct?
Not at all.
It doesn't indicate if he even met with the child. It's kind of vague as to whether or not he did.
I think he said he met with the child.
Right, but it's unclear once, twice, beyond that.
Right, that was hard to determine how many times he had met with the child, how many times he'd met with the parents. But he did say they had ongoing communication.
And if he did in fact meet with them, the time frame that we're talking about is after the child, the victim in this case, was 10 years old, correct?
That would be right.
And you're familiar with the DSM and the criteria that they have for reactive attachment disorder, correct?
Yes.
That manual also provides some cautionary instructions that practitioners should take into consideration when reaching a diagnosis, correct?
That's true.
And some of those cautionary instructions as it applies to reactive attachment disorder is that it shouldn't be diagnosed after the age of 5, or if it's done, it should be done with extreme caution.
I agree
Correct?
with that.
That's what the DSM says.
Yes.
And based on the very limited information we have from Mr. Miller, we don't know why he is making that diagnosis after 5 years old, correct?
Right, I'm not sure why. I'm assuming that he would make a diagnosis the way anybody that is licensed would make a diagnosis.
And then you also review the records of a Dr. Reichenbacher.
Yes.
If I'm saying that correctly. And Mr. Reichenbacher is a psychiatrist.
Correct.
And he, you have some of his treatment notes from his meetings with the family and the child, correct?
Yes,
He notes reactive attachment disorder and ADHD, correct?
he does.
But he has no indication of the appropriateness of whether or not why he's making that diagnosis after 5 years old, correct?
Right, I don't think that you would normally see in somebody's treatment summary how they arrived at that diagnosis. You would see the diagnosis that they rendered, and you would assume that it was because they had records available or interview available, however they made the diagnosis. But we would assume if somebody is licensed that they're giving a diagnosis based on their professionalism and their knowledge.
Right. And so you're making some assumptions about what they're relying upon because we don't have any additional information, correct?
Right, but there are standards and rules of how we diagnose somebody. So it would be very rare indeed for somebody to be diagnosing out of the blue with no information whatsoever.
Now, in looking at Dr. Reichenbacher's notes, there's no indication of whether or not in making his diagnosis that he was aware that during this time frame, the victim is being confined in a structure that his parents built in the garage, correct?
Right, that is not in his notes.
There's no indication that he was aware of that, correct?
Correct.
And that would be important information for a psychiatrist to have in making a differential diagnosis.
I think so. I would have liked to have that information.
Now, Dr. Reichenbacher saw Ronan between December 2018 and January 2019, correct?
Yes.
And so the last time we have of him being involved in all was January of 2019, correct?
Yes.
Which is 2 years prior to the arrest in this case.
Yes.
Now, there's a handful of meetings, 3-4 meetings total, correct?
That's right.
And the meetings, aside from the initial assessment, are about 20 minutes long.
Yes.
And the victim in this case is 11 years old at the time.
Yes.
And so in December 2018, they have their initial evaluation, correct?
Yes.
And the recommendation is that perhaps the victim in this case may need behavioral therapy.
Correct.
And then in May 7th of 2019 is the next meeting,
Yes.
correct? And it's noted from the report that the parents reported to their psychiatrist that they were seeing for the behavioral problems of their child that he is not having severe aggressive behavior at school. That's what the parents report, correct?
Yes.
And they also noted adequate behavior at school regarding focus and hyperactive behavior, correct?
Yes, he had been placed on medication at that time.
And then the doctor decided at that point that the treatment going forward would be to continue medication and therapy, correct?
Yes.
But there was a problem because the parents were going to go away for the summer, so he might not be able to get that therapy.
I don't remember why they didn't, but they didn't get the therapy at that time.
Now, in January 23rd, 2019, they also went back to Dr. Reichenbacher, correct?
Yes.
And the chief complaint that his parents brought was that he has some anger, correct?
Yes.
And the mom reported some improvements in his ability to not get angry or apologize and later on, correct?
Yes.
And the child got tearful when his mom was talking about him, correct?
That's what the report said, yes.
And they reported that he had not been seeing a therapist at that point. And the doctor, again, recommended that they should do medication and meet with a therapist, correct?
Correct.
At no point did Dr. Reichenbacher recommend confinement
Never.
to the parents.